attacks rising during this pandemic.
WGN medical reporter Dina Bear explains what to do.
If you saw someone having a panic attack, would you know how to react? What if you felt the telltale symptoms that seem like a heart attack? Tonight, some advice on handling what has become a growing problem with the stress of COVID-19. The world seems to go dark. The chest gets tight.
Feel like I couldn't breathe. Feel like I was having a heart attack. Shakiness, just out of control. Didn't know what was really going on. Very scary.
On one occasion, Brian Dudek went to the emergency room.
I went through tons of testing because we couldn't figure out what was going on, and it ended up just purely being a panic attack.
But even though the symptoms are rooted in the mind, they do manifest themselves physically.
So the brain is triggered as if we were in the woods with a bear. And when we have a basic situation at home, our brain is triggering us as a false alarm. So it's increasing our physical symptoms just as if we were encountering a bear. And that's what makes it the most scary, because it's such a fast surge of symptoms that make the client extremely afraid. And so then the mental health, the brain starts thinking, what's happening? Am I dying? I feel like doom and gloom. And then the patient kind of just spirals and it keeps on moving.
And while the instinct for most is to have someone sit down and tell them to calm down, it's the worst advice.
You get told that a lot, or you're fine, just relax, you're fine, no big deal. A lot of the time, it almost gets me a little more worked up, because it's like, just leave me alone, let me work through it. You're not helping by telling me I'm just fine, because you don't feel just fine.
Panic, it's a lot of uncertainty. And really what we want to teach patients is you can tolerate uncertainty. And so instead of saying you'll be okay, you're safe, we like to say, you're uncomfortable, it may or may not feel good, and guess what, you'll tolerate it and you'll get through it shortly.
And since we don't know how long the COVID-19 threat or the isolation and frustration that comes with quarantine will last and potentially trigger panic, experts say just know you are not alone.
No one loves uncertainty, and now uncertainty is at its all-time high. And so I think a lot of people in general, whether you have high anxiety or not, are just really struggling to manage what does the future look like, whether it's in 3 days, a week, a month. And so, yes, lots of panic symptoms on the rise, lots of people coming in, just, I don't know what's wrong, but I just feel anxious.
Go have a doctor. Check out the physical symptoms, because it will make you feel better that nothing else is wrong. Then go to a therapist to get the proper mental health treatment.
Anxiety is such a unique diagnosis. It's so general. Everyone has it. We have it to get up out of bed and to kind of get through our day. But when it becomes clinical, it's a nice discussion for people to realize it's treatable. And that's why I love treating it, because the standard exposure response prevention treatment for it is so amazing. It works so well, and these clients see progress so fast. And that's what's the most rewarding part for them.
You can't control things that are out of your control. You have to be okay living with the fact, knowing you have to deal with this for a long time. Luckily, I've been able to learn how to live with it.
If you don't want to leave the house or enjoy the things that typically give you comfort or joy, and if COVID swirls nonstop in your mind, that could be a sign anxiety is out of control and therapy or medication is needed. We have a link to resources at Compass Health on our webpage. Back to you.